Hi friends! This video is going to be talking about thyroid cancer surgery and what it is and what are some of the information I found online that's different than my own experience and why, why did I create a YouTube channel? So, like I said in my intro video, I previously never had any thyroid issues. Practically my blood work came out fine. During a checkup for something else related, my PCP was able to feel something in my throat, and I followed up to get a sonogram and eventually a biopsy that confirmed that I have cancer cells. And it's about a 2 centimeter nodule on the right side of my neck. I don't have any symptoms. I can feel up and down my throat. I don't feel lump at all. So I would like to think that, they've discovered this early, and it's a good thing that they will know what to do next. I was really, nervous about the actual scar that I saw a lot of women have. I know that's cosmetic and it shouldn't really matter, your health comes first. But I couldn't help to feel really scared and also very conscious about having, a large scar right over my neck. Most of the videos that I found on YouTube were of these videos of women who have vlogs with that, or surgical videos with like graphic video content, which I don't really like, and that kind of freaks me out. And also doctor presentations that explain the details of the disease, which I'm not gonna pretend that I know everything about that. So when I got referred to this surgeon at Weill Cornell, I didn't know what to expect. All I knew was that he was a great doctor because other doctors say that he is, and I've read his bio. He not only does surgery on the thyroid gland, but also surgery of like esophagus to your stomach, so he has more experience. And honestly, from a patient's point of view, when I'm reviewing these surgeons, it was kind of funny to me that I had to pick someone. And in a way, I felt like I could only be ageist, because every one of those surgeons are experienced. They have great credentials, and what do I know, right? And a surgeon isn't someone that you can have a practice run on you. You just need to trust them wholeheartedly going in, and just based on their experience, you just need to let go and trust. I've never been in that situation before. When you're going to the medical doctor, you kind of have a relationship with them, and it's not like something where you meet somebody for 30 minutes and you're like, yeah, let's go, surgery time. And also, going to the appointments, they all show up in a team to make you feel better. But, for me, I just felt so overwhelmed having 5 people come in the room. They're all well dressed. They introduce themselves to you. They tried everything to make you feel great. But on the inside, I don't think that that's something that, I could ever get over. It's just tons of people rolling in a way that makes it such, it makes it such more real. When you see 5 people that are going to take care of you. So that was my first initial reaction to going into the office. So during the consultation, the surgeon was extremely nice. He had great bedside manner. He made me really feel at ease. and I really walked out of there feeling like I got really lucky and I was at peace. I found out that he does about 7 surgeries a year, which blew my mind. That's like somebody doing a surgery for like three times a day, if not more. Just his normal life, in and out, doing surgeries. Like I just never put my mind into that before. Like people just getting surgeries one after the other, like day after day. And there was one very, very different thing that he talked to me about, that he was writing a research paper about how women have self-consciousness and feelings about their scar afterwards. Like that's the first thing, you know, women tend to talk about right afterwards, is like, do I like my scar? Did my surgeon do a good job because the scar looks good? Or how's your treatment of your scar? Like it's a really important thing because it was so visible. So he actually mentioned to me that he had skills to be able to do it laparoscopically, like basically using a robot to do the surgery for my armpit. And I've never heard of that. I've never seen that in a video on YouTube where people could get the thyroid surgery through another location. And I said, you know, what exactly is the difference, and is there some more risk or less? He said like there's not an increased risk at all. It's the same risk that you would have doing any surgery, but it's just a little less time effectiveness, meaning that he's projecting to do it the regular way, which is like to get a surgery right across your neck, would be about 40 minutes an operation time, but doing it through your armpit, it would take about 1 hour and 40, and to him is no difference. But the outcome is that, you know, you won't have a scar right around your throat. And unless you're a professional volleyball player and you're getting armpits photographed all the time, you won't see those scars. And especially with laparoscopic, the scars will be, you know, 2 centimeters, like, you know, 4 incisions that are like 2 or 3 centimeters in length, which sounds absolutely crazy to me because I wasn't really familiar with like any kind of like minimally invasive robotic procedures. So I did have time to speak to my friend Melissa, who got me all up to speed about like what's a robot and what how many arms does it have, and you know, what does it do? Like one arm is going to pump gas in your body, another one's a camera, and there's like 2 little tweezer like hands that will go through and do its job. So after hearing that, I was just so shocked that someone can do it. And then I asked him like, how come I haven't seen this type of option on the internet or whatever? And he just said like, because traditionally thyroid doctors are just trained to like do that procedure the same, and there hasn't been a new advancement, and people who are in the robotics field are always trying to advance their techniques, and he feels confident he can do this since he's done so many surgeries through the esophagus. It's just going, instead of going down, you know, he'll just go up. So I'm shocked that he has the skill, and you know, at this point I trust his expertise and what he's doing, and you know, all I have to do now is to be calm and put my faith in him. So in terms of the details of what they're going to do is during surgery, they're going to test if that cancer cell has spread to other parts of my thyroid, Currently going in, they're preparing to take out half, and if they do sense that it is on the other half, they would have to remove it in full. Many people who have removed half will just have to get checkups really regularly, and if it does come back, they would have to repeat the surgery and remove the other half, which yeah, I wish that's not going to happen to me. The positives of just removing half is that it is gradual, like it's not aggressive where you're like just removing everything. And when it's gradual, your other part of the thyroid might be able to produce enough hormones for the rest of your body so that you don't have to take as much hormone replacement medication afterwards. But if you do remove everything, you will need a medication for the rest of your life for everything. So I guess taking it like minimally aggressive approach is their stance now, as opposed to previously in the past, if they find something, they would just remove the whole thyroid. Now, if after they remove and they find that cells have spread to the other side, but has not any physical symptoms or have physical nodules, they can give you something called a radioactive iodine therapy, which is basically swallowing a radioactive medicine that will target your throat and kill all the cancer cells. One thing I was really worried about that was the radioaction materials will basically also attack my ovaries, which basically is saying that, like, you can't do IVF for the next 6 to 12 months because of if you have radiation in your body, you basically can't do any of those procedures. So in that sense, I'm just leaving it to God. It is not something that I can control, and I should not allow that thought to keep ruminating in my mind. I just have to accept what is the outcome, and in a way don't have a choice, because it's priority to not have cancer. So if you do take that radiation medication, you do. With the radiation medication, of course, it does expose you to the ability to have more cancer after you take that. So it's definitely a risk. All in all, I'm just hoping for the best case scenario, which is they're able to remove, and I'll have a lot of testing done afterwards to make sure that I have the right amount of replacement hormones going forward, and having a speedy recovery. As opposed to post-op, I'm expecting about 3 days of throat aches and hoarseness and my voice, and bed rest. And most of the people that I've watched, they felt a lot better at day 7. So I'm only taking about 2 weeks off work, and I'm hopefully I will be back on my feet then. One caveat is that I think that my voice will change and will probably sound different after these videos, which is why I'm kind of trying to make new videos before that happens. Some people do have vocal cord issues afterwards, or even raspy voice or weakness in voice, but that usually can return back after a couple months. So the outlook seems very reasonable and doable. So right now, I'm pretty positive about going into the surgery. So my next video will be a vlogging through the actual surgery itself and after. So you won't be seeing a video from me on a weekly basis. Still, stay tuned.